Implementation is the next phase in the nursing process. Prior to blood product administration, the nurse must verify the healthcare provider's order for the product. An informed consent must be completed and signed prior to product administration. The lab runs a type and cross-match prior to the blood bank preparing the unit for the patient. The patient must have an IV in place. It is the nurse's responsibility to ensure it is the correct gauge, an 18 or 20 preferably for the adult patient, and it is patent. If the patient will be receiving the blood via a central line, the nurse must ensure its patency. The nurse should complete an assessment on the patient, including vital signs. This provides baseline data. The ordered blood product is received from the blood bank. Personnel trained to pick up and verify information with the blood bank lab tech may retrieve the product. On this slide is a form that will be attached to the blood unit. The left side of the form contains the patient and unit information. At the bottom, the lab tech and the person picking up the blood sign to confirm the information matches the unit of blood. The right side of the form is where the two nurses sign after information confirmation. This is also where the nurse documents the patient's vital signs. On the right, there is a photo of a simulated unit of packed red blood cells. The bag should be inspected for abnormalities such as clots or air bubbles prior to administering to the patient. When the blood arrives on the nursing unit, two nurses will verify the information on the blood product with the patient's identification information at the patient's bedside. Supplies needed to start the transfusion include a bag of normal saline, the blood unit, the blood IV tubing. You will see here we are preparing to transfuse a unit of packed cells. The IV tubing used for blood administration is Y-set tubing. One tubing is spiked into the normal saline, the other into the blood bag. The tubing also has a built-in filter. Remember when working with blood products, always to wear gloves. The blood transfusion must be started within 30 minutes of arrival from the blood bank. If it is not, the unit must be returned to the blood bank. The infusion should be started at 2 milliliters a minute for the first 15 minutes. The nurse is to stay with the patient during this time and assess the patient for a reaction. Most reactions occur within the first 50 milliliters infused. At 15 minutes, the patient's vital signs are taken and compared to the baseline data. If the patient demonstrates no signs of a reaction, the infusion may be increased to complete in the ordered time frame. If a transfusion reaction should occur, the blood infusion is stopped and the healthcare provider notified. One reaction is fever. The patient may be ordered an analgesic for this type of reaction. An antihistamine may be ordered for a mild allergic reaction. An anaphylactic or hemolytic reaction will require emergent care following protocol. Other complications that may occur include fluid overload and infection or sepsis. Although the blood products are thoroughly screened, there is still a slight risk of infection of hepatitis C, hepatitis B, and HIV. During the transfusion, the patient should be monitored closely and the vital signs taken every 30 minutes or according to hospital policy. When the transfusion is complete, the nurse is to disconnect the blood and flush the IV with normal saline. The patient's vital signs are taken again and compared to previous data. The blood bag and tubing are placed in a biohazard waste receptacle. The nurse would then check the healthcare provider's orders for any follow-up labs to be completed. Accurate and detailed documentation of the procedure is completed by the nurse.